Welcome back to the programme. Slimming pills, diet programs, gym workouts. Those wanting to shed their extra weight would have tried all of them.
But there is another option, and that's surgery. Although doctors will be the first to tell you that this shouldn't be taken lightly. And using surgery to lose weight isn't for all obese people, and doctors won't recommend it unless it's absolutely necessary.
And to explore who's a good candidate and who isn't, we speak to Dr. Tam Kwang Wei and Dr. Shanker from the Singapore General Hospital. Good morning, Dr. Shanker. Tell us what types of options do obese patients have if they want to undertake surgery?
Good morning, and thanks for having us on the show. I think before diving into the surgical options, I think we need to understand first the profile of the patient. This is very important because obesity has a lot of correlated medical conditions and physical problems. So before we decide to operate, we need to understand these things to know how best they can be helped, because there's so many different types of surgeries. For example, in terms of medical problems, diabetes is the main one, physical problems, joint pains and all that. And then we have to understand the profile of the patient in terms of, have they been obese for a long time? Have they had recent weight gain? Do they have yo-yo problems and all that? Because in terms of surgery, broadly, we have two types of surgery. We can restrict the intake. That can be done with a band or with a stapling procedure, or we can add on an additional aspect, a mechanism, which is a bypass. So that's sort of the second type of mechanism of surgery.
Okay, well, before we get into the technicalities of surgery, then perhaps explain to us who are the people you would recommend to go for the surgery option, and who are the people who will get rejected?
Actually, this is a very difficult question. I never offer surgery when I first see a patient. Always talk to them to understand them, because people have different ideas about, weight and all that. And weight is actually a reflection of someone's relationship, not just with food, but their entire lifestyle, the way they move, the way they live in general. So I think this is very important to understand that. And the short answer to that is, if someone wants to succeed in weight loss, they can. And that's what we are there to help them with. And it's not just the surgery, because it's also how to change the way they eat and the way they live, move, exercise. Sometimes there's psychological barriers as well.
Right. So are you saying that then surgery is the last option? For all the options that you've offered, it failed, and therefore they go on to have surgery? I mean, do you do that as well, Dr. Tom?
Well, I don't think it's the last resort. In fact, many medical bodies around the world are actually recommending metabolic surgeries, what this has been now coined, to be a therapy for even things like diabetes. So if, let's say, someone who qualifies based on their BMI or their weight and their height ratio, and have a condition like type 2 diabetes and have really maximized their medical therapy and still not well controlled, we actually do offer surgery as an option, especially if they have other complications related to diabetes. Because
it really is a case-by-case basis. Everyone has a unique medical history, so depending on the situation you're in, you'll be given the best advice.
Right.
Then let's jump right into the surgical options. What are the different types of surgeries that we have?
Well, as I mentioned, we have restrictive procedures, and for that, the most famous one, I think, is the lap band, where a small silicone tubing.
Okay. You've actually kindly brought us a sample to have a look at this. We've also got a diagram, the slide up for you, so this actually illustrates pretty clearly.
Exactly. So the banding procedure is actually a restriction of the inlet of the stomach, right? So it controls, or you can control what you eat, because you've got this sort of a valve now on the top end of the stomach. Now the band itself is a balloon, and that balloon can be filled. So that's what it means by an adjustable
band. So this part actually...
The inner part, that balloon, sort of, if you squeeze it, it's soft.
Right.
But if you fill it with fluid, it gets tense. So that part sort of then compresses on the top end of the stomach, and therefore tightens. Yeah, so it gives the patient a sense of tightness. So that's how it works, by regulating. So what you need to do is you need to eat small mouthfuls slowly. And if you can imagine, if you had to chew through 1 or 2 minutes each mouth, in 10 to 20 mouthfuls, you'd be fed up of what you're eating, and that, you could control the way.
And is this regarded as one of the most effective methods of weight loss?
This has been around for a long time. It's regarded as one of the safest surgeries, because nothing is cut at the time of surgery. We just place the band around the stomach. In terms of weight loss, it's quite gradual, because people need to make these changes. So this is very important. That's why you asked earlier about, what kind of surgery and all that. we need to talk to the patient. I need to understand, can you eat slowly? Do you understand that you cannot just rush through things?
Right.
You know,
Can you commit to it,
can you
right?
commit to this?
What about the other options like stomach stapling? How does it differ from this? And we also hear another term, stomach bypass.
Yes. Dr. Shanker, I guess perhaps could explain a little bit more on that.
Well, the stapling essentially is to reduce the capacity of the stomach. So the stomach is like, it can expand when you eat and you go on the buffet line, you go 3-4
Correct.
times on the buffet, it just expands. The food is not going down the gut, it's just in the stomach. So if we do a restriction or a stapling on the stomach, then you restrict the capacity that you can eat. So it's a restriction not of the inlet or the intake, but a restriction of the volume that you can eat. So that's a slightly different mechanism. So again, you know, and then there's no foreign body involved because this is a foreign body inside. So some patients say, Doc, you know, I don't want these things inside me. I just want to...
Now we spoke about who are suitable candidates for undertaking surgery, but there must be people that aren't suitable at all, and who are they?
Well, first and foremost, they have to qualify by what are called body mass index criteria that's set by the local guidelines. And of course, if someone should want to have this, because as Dr. Shanker has mentioned, there's a whole lifestyle change. You must recognize that after or even before surgery, they have to change their way of eating. So surgery is just a modality to help. It's like, you know, help you to restrict the amount that you eat, but they have to work along with the surgery that has already occurred, okay? Well, also people with medical conditions like type 2 diabetes or at risk for cardiovascular disease or severe, you know, knee problems because of the weight, so these are good candidates.
Dr. Tom, I'm also curious because of late there has been increasing attention being put on the fact that we put in a lot of effort pre-surgery to prepare them to expect what to do and how to commit themselves, but there isn't enough, I think, help after surgery because it's sort of suddenly I'm skinny, I'm in a new body, I have an identity crisis. I mean, is that a concern now? Is that becoming a bigger importance?
Well, yes, definitely. That's why before surgery, we make sure they go through a psychological assessment by our trained psychologists. So it will be just to make sure that they're motivated, they know what they're expecting after surgery, and then also to guide them through, you know, are you going through any stress? So if you're going through a stressful period, perhaps it's not the right time for you to undergo surgery because of the changes that are expected. Do you have family support or friends, you know, who can support you through this period of time? So after surgery, we do see them quite frequently, like a week and 2 weeks right after the surgery with the dietitian. So it's really a team approach from our side, supporting the patient through the different phases.
Even after surgery?
After surgery, yes.
What is the success rate? I mean, 5 years down the road, how many % of your patients are still able to keep their weight there, or how many of them actually rebound?
Actually, that's a great question. It's very hard to have long-term data. Our program is very young. We're just in our 3rd year. So I can tell you that at 3 years, we have one patient who has regained the weight. Out of 68. So this one, and then if we look at the profile of the patients who regain the weight, they eat very frequently, and this particular patient has got issues with depression, and lots of medication as well. That makes patients hungry as well. So all these things have to be taken care of. It's very, very important. And really keeping that foot on the pedal, that's what we're there for. We have a commitment that we will manage patients for life. Because we see patients, certainly in a public hospital where we're at, we see patients with medical conditions. So we're exchanging the disease to now, you know, try to manage their weight and their lifestyle, and as I said, we try to transform their lives.
And you track them even after surgery, so it's like a holistic approach that you're taking.
Absolutely.
Well, thank you so much for sharing insights into this.
Thank you very much for having us on.
For us, our guests this morning, Dr. Tam Kwang Wei and Dr. Shanker Pasupathy from the Singapore General Hospital on weight loss surgery.